You've got a lot of important things. I've got a lot of great endorsements from people who have said what they think of you, and I mean, I think the people ought to know.
Do you really want them to know what they think of me?
Well, those are ones I didn't bring. The ones that said that, oh, that guy, Doctor. Thank you so much, Freddie.
Actually, I've read the complaints about me, and there's none about the service. So that should tell people one thing: the service is good.
So
what's my service?
So
Taking away your pain. That's what it is.
So why they complain about?
Oh, how much it costs, or various things.
Well, wouldn't it be fun to know that how much is it costing your life to be in pain? Isn't that more important?
Well, that's the idea. So you want to?
Do we have a call already, Russell from Jupiter? Oh, I was wondering, Joe. We didn't even give the number out. So, Russell, if you're out there, it's 800-889-0267. We already know who you are, so give us a call. Okay, so first of all, Freddie, we didn't have a chance to say good morning to you. You're our sports guy. You know what the heck's going on in sports, right?
I'm not even ready yet.
Freddie's not ready.
Well,
we want to apologize to everybody. They put us on quicker than we thought we should have been on, so we're still ready.
There was D.T. Knighton. Do you know him, D.T. Knighton?
Do you know who D.T. Knight is, Freddie? No.
He has cluster headaches.
Wow.
He went to 20 doctors already. He still plays football, though.
With cluster headaches? Yeah.
But there's no such thing as cluster headaches.
Yeah, you told us. What is a cluster headache?
Oh, it's just a bunch of headaches together.
Oh, that's it?
Yeah, that's all.
You know, it's funny. I wish my father-in-law, who passed away.
See, these people don't.
You didn't know him anyhow, so it doesn't matter.
They don't even know where a headache's from. Right. So they describe it. Like when I went to school, they would describe things like a swelling as big as an egg, or as big as a melon, So they describe it for some how to tie it into things you already know. Mm-hmm. So they call this cluster headaches because you get 3 or 4 in a day or something like that.
Isn't that like the same as a migraine?
But it's false. It depends. Yeah. It depends on how much activity you do, because we know where headaches are from.
Right.
We know that.
Well, I guess what? Guess what else? Who knows it now? The NFL. They're finding out it's the shoulders.
Shoulders?
The neck.
No, neck.
Well, did I tell before you read that?
You're talking about
concussions.
Concussions. There's no term of concussion. What does it mean? Nobody knows what it means.
No.
Unless you have changes in the brain.
Oh, I've always had brain changes.
Then what difference does it make?
Right.
So the pain you're having, though, is from the neck. There's another one, T.E. Chandler. These are all football players. Mm-hmm. He's going to have knee surgery. It will end his career.
Oh, yes.
Why do it? It's craziness.
That's what we're trying to tell people. Why go? I mean, I know people that have had their knees done. They're in worse pain now than they ever were. And that's documented. In fact, he's going to come on the show and talk about what he went through. Our buddy.
Oh, it is? Jim?
Yeah, Jim. He's going to come in and tell what he went through with some of the top surgeons in the country.
Here's a Tiger Woods thing. This was in on Yahoo today. Mm-hmm. Looking back at Tiger Woods' injuries, and whoever this reporter is, they documented all the injuries he's had.
Wow.
And it is voluminous, and he still keeps the same medical staff that he had.
There's a way.
They keep operating this guy. What are they operating? They don't even have a clue.
Do you know what happens?
Surgeons do not do musculoskeletal work. I mean, how do we get this across to people?
Well, evidently, people that are listening, there are people coming in every day new and are saying to you something like, "Where have you been all my life?" I mean, I've got letters here that I'm going to read later that's going to blow everybody away.
Well, the amazing thing here is that the everyday person continues to live in pain. Then you have athletes that continue to try to perform with pain, and the solutions that they're giving you are not solutions. They're Band-Aids. Yeah. Baseball, a new number, 215 innings for a pitcher. They don't want them going over that number.
Yeah, well, here's the article from the Wall Street Journal talking just about that. Baseball babies its arms, it says. To prevent elbow surgery, teams are giving their valuable young pitchers a message: pitch less. But you see, you don't have to have an elbow operated. There's nothing to operate there.
Why don't they understand that?
Well, because it's a marketing tool for surgeons. That's all.
But what you're doing is you're taking people and you're putting. I mean, when Freddie was a coach, I bet you would give your left arm to be able to have someone like him that could get your players back out on the field.
Of course. I mean, the object of the game is to get guys from the injury list onto the field. Mm-hmm. Now, what the thing that article doesn't cover, though, Doc, is that the guys that come back from this particular surgery have great skills to begin with. Mm-hmm. The Harveys of the world. I mean, the Met pitching staff have all had the injury. So when you go in there and you operate on the arm, you're working still with half an arm that has talent. A kid that doesn't have talent and needs to pitch, it has to be farmed.
Well, if you can get a range of motion, normal range of motion, then you can use that. The trouble is you have scar tissue now. And how do you overcome that?
That's right.
How many people come back?
Only 24% of the surgery is successful.
Okay, you hear that, guys? Only 24%. That's not enough.
And you better have talent if you're in that pool of 24, because if you don't...
If you have talent, you can overcome an adversity like
that.
But not totally, right?
If you don't have talent and you need to pitch, that 215 innings goes out the window. You can only get better at your trade if you continue to do it. Mm-hmm. Bartolo Colon is a prime example.
Well, Tiger Woods is a prime example. He can't practice and play on the level he played before because of operation. He's gone through how many? Maybe I think 4 back operations.
Well, it's 3, but it's 3 pages of surgeries he's had on everything.
Wow.
Knees. I remember a couple of years ago, I wrote to his manager. Mm-hmm. In Cleveland, and I said, don't let him get his knee operated, because I watched him walk, and it was mainly his hip was affecting the knee. And I said, we can fix this up. In 2 weeks, he'll be back on the thing, no problem. Well, he got operated anyway, so that was operation number 1. And he's had it several since.
Yeah.
ACLs, which doesn't exist. I mean,
well, you know what?
I mean, it goes on and on and on like that.
Again, the reason I repeat a lot of stuff here is because we have new listeners almost every day and new TV listeners. Let me ask you a question. So when they say ACL, what does ACL stand for?
Anterior, it's a ligament.
Right.
And it holds the
anterior
tibia.
Cruciate ligament?
Cruciate ligament, because it crosses.
Right.
And it holds the tibia and the fibula. It holds the tibia and the humerus, the fibula together. No.
It holds something together.
It holds the 2 bones together.
Right.
And it's only this long. How in the heck do you hurt that? You can't hurt that.
Well, and the argument that I've had with people in the past is that even if Dr. Pannozzo can remove the pain in that area so that you can use the knee, that the area would be unstable. And
that's not true.
But that's the word they use.
Yeah, it's not true. It's not. It doesn't add to instability. You don't even need it.
So there it is.
Well, what's amazing to me is any surgery you do has scar tissue. It doesn't matter what you have done, it has scar tissue. So we know people that have come in after knee surgeries that still have pain.
That's right.
Okay,
we've seen it.
Yeah, why is that? We talked about this before.
Scar tissue develops.
It's a capsular pain. It's not inside the knee at all.
Right.
So anytime you go inside the knee to operate there, you're wrong, because that's not where the problem is. It's on the outside.
But how do we get these athletes and these other agents understand that? I mean, this is their livelihood.
Well, I think they're just talked into surgeries, and why they allow themselves to do it. Well, they don't know any better. What are you going to do?
You know, the funny thing is, Drew and I had dinner with Lawrence Taylor a couple of nights ago, and
who paid the check?
Lawrence did.
Good man. How come you don't invite me for those?
Because I was invited. They didn't tell me to bring.
He said, "Oh, that last guy."
No, we don't want him. Okay.
He said, "Don't bring." He says, "Who's last?" But anyway, he was talking about football injuries, and it's really strange the way the whole thing comes about, because a football injury starts with the managers of the guy, his client, his agent. Injuries go from the guy. Okay, he's hurt. Now the agent steps in, the doctors step in. The team steps in. They have like this giant meeting.
Is that what he was telling you that? Yeah, it's amazing.
They have like this giant meeting of what to do with this injury. And it's all based on everybody's interests. And they'll all say they want to get the guy stronger. They want to get him back. But the bottom line, if you look at the way they go about it, it's the surgeon's reputation, it's the agent's reputation, and it's the team's reputation before the player.
So they're saying this surgeon that has gone against 12 other surgeons to get this contract to a specific NFL team, he gets the ability to say, surgeon of the NFL Miami Dolphins.
Right.
That's a lot. That's a lot of cachet. Am I right?
Well, the agent. If you look at what happened last year with the baseball player, the agent was in the newspaper saying my client is not going to pitch any more than 215 innings, and then he got the doctor to agree. No, he shouldn't pitch more than 215 innings. Now the Mets needed this pitcher because they were trying to make the playoffs.
Right.
So they started to play around with it. I mean, it was a wonderful dance, is what it came down to. But he pitched over 250 innings. With no ill effects, even though he lost 2 games in the World Series.
Well, I watched a couple nights ago Jerry Maguire when that was supposed to be
Jerry Maguire, yeah,
and that was supposed to be that guy, the big time guy.
Agent.
What's his name?
Whatever.
Okay.
You don't use.
I don't want to use his name. And it showed what these guys go through. Well, he had a bad knee, so we got to get that knee fixed before the NFL knows, or he's got a bad back. So they want to get this all fixed. But then what happens is the guy gets hurt, because they didn't really fix the problem, as we found out from people that you see, the one I sent to you.
See, that's the biggest
Doc, you can't read the newspaper.
He's on the subway.
When you think of Manhattan on the subway?
He's on the subway.
I was just reading about a Tommy John surgery. It's a procedure named after another Dodger left-hander who had his
Tommy John
elbow medial ulnar collateral ligament replaced in 1974. He wasn't expected ever to pitch again, but after missing a year, John went on to earn 164 of his 288 total victories.
Yeah, and he went on to win the World Series.
I didn't know that.
You don't know what time?
I thought it was a doctor.
Do you know what the process?
No, it's a pitcher.
The process is. It involves removing the ligament that essentially binds the upper and lower arm, drilling holes in the bones, then tying them together using a tendon from the wrist, leg, or cadaver.
That's right. And most of them are from the
surgery only takes about 75 minutes, but often requires 18 months for a full recovery.
Oh my God!
The whole thing is totally unnecessary. I treat elbows.
Right,
and
I know.
There's nothing in there. If you have a sprain of that, if you're over pulling a tendon, then you put a steroid in there. That's all you need. Mm-hmm. It comes back to normal.
And it never comes back.
How many have we treated?
Well, I personally brought in 5 people.
Yeah.
No, 6. The girl was 6. Yes,
and
6.
They don't come back.
No.
Once they're treated, people have full activity, and the pain does not come back. So what are they operating here? I think it's a manufactured out of somebody's brain. I have no idea.
Well, and there's a new thing now.
Because I actually do this work, and I'm saying I don't understand what they're trying to do there.
Well, I think, like Freddie said, it's this big group of people that come in. Like, for instance, the trainer wants to make sure his athlete is playing so he can make his commission. They believe in what the orthopedic surgeons are saying because they paid a lot of money to get this guy in.
They're only listening to part of the problem.
Well, guess what, guys? Gio, you remember Christopher Mata? Christopher Mata is a kid that I used to babysit. I used to take care of him when Gio was a puppy, and the kid has
He's still a puppy.
I'm a human.
And the kid has grown up to
Since
pitch.
That explains so much of my childhood.
A little human. Well, this poor kid, what he went through.
Well, Christopher Mata has grown up now, and he's pitching for the Philadelphia Phillies affiliation.
You work with him?
Yes.
Oh wow.
And I spoke to him, and he had Tommy John surgery a couple of months ago. So I've asked him to come in and talk to us about the surgery. And he sent a picture of the scar and everything else. And the way it was explained to him, that he's not allowed to throw now until, I think, 4 or 5 months from now. So he's going to be out 18 months before they'll let him pick up a baseball again.
So what causes that? Is it the amount of
the interesting thing,
inertia that's using to throw the ball?
Well,
is that what it is?
They're saying that the Achilles snaps.
The what?
Not Achilles, it's on your foot.
Not the Achilles, that the ligament tears, and they have to replace it.
It does not. How would you tear a ligament?
Yeah, that's what I did.
It's impossible.
But
it's MRI read. You understand the MRI read? Everything's a tear with an MRI.
He's going to be sitting here, and he's going to tell you what they told him. And don't yell at the kid, because I love the kid.
I'm going to yell at him.
Yeah,
But-
you yell at that guy for
but-
doing that
but he
stuff.
was-
Because that's what I do.
Yeah,
There you hurt yourself.
Damn
playing
it.
something.
But he was told this is the way, and the team paid for the surgery.
Why wouldn't they pay for the surgery?
Why are you looking at my phone?
The team
No, I need
paid
to know
for it?
something.
Who paid for the surgery?
Team.
Team, of
The
course.
team did.
Well, here's what I've learned.
Why? Because they hired
Absolutely
a
nothing.
surgeon who recommends that, and so
That's
they're
it.
obligated to do that.
Under that contract.
They really don't need to have that surgery there. I would tell you again, if you're planning on doing it, don't do it. Let me see you first.
And let's everyone understand, the steroid that Dr. Pannozzo, the reason I can say this is I've been doing this for a couple of years with him, is something that goes out of your system, and it's not an enhancement steroid. It's a steroid that actually works.
Just takes inflammation off.
That's all it does, and it never comes back
Because
again.
when a ligament is injured, it becomes inflamed and starts to tighten down.
Mm-hmm.
It doesn't want to move, so inability to stretch. Remember that diagnosis.
Inability to stretch.
Inability to stretch. That's a ligament. But if you put a steroid on it, in it, close to it, it resolves that inflammation, and then you get the ability to stretch again.
Well, it's funny because I brought someone over to talk to Jim about where's yours?
It's in my bag
Oh.
that I didn't bring.
Somebody left this. You want to use this one? Make you feel more comfortable?
No, this is good.
Okay. And here's a guy, very extremely bright man, who has fix your hair.
What air?
You know, if you want to be discovered by the big time people, Doc, we have to get your hair like Gio, or I was going to say like Freddy, but how long does it take you to get up in the morning and fix your hair?
It takes
and
him
brush your
hours.
teeth? Hours.
Hours.
Really?
Really.
Wow.
He uses so much product in his hair.
See, Doc, these guys, they think they're on the wrong show because they do a show during the week and they think they're on that show.
Okay.
Why don't you guys focus a little?
Let me tell you something about the NFL. What they I just heard it on one of the sports stations.
Wait, are we done with your story?
I can't even remember my story because this guy
The
started
story
talking.
was about Tommy John.
Correct, Tommy, and it's funny because every time you say Tommy John, he gets a penny.
Really?
Every time he is because he's patented the name.
Wow.
But that particular surgery right now is they're protecting the doctors because of what happened with the Mets last year. And all these pitchers that are getting it done, they've hit the magical number, and you're going to see more Tommy John surgeries than you've ever seen before. This is why it's important, ladies and gentlemen, that you get a second opinion. And what I don't understand is we've written to Major League Baseball to ask them just to take a look at what the Pannozzo could do. Nobody knows what he can do because they won't bring him forward.
The bottom line is it's worth just to come in.
That's right.
You don't have to
because-
get a shot if you don't want it, but it's worth to come in.
Well, I like to see under the Major League level, which is the highest duress on the body.
I think it's worse
We'll
than
say that.
football.
No. I'm just saying that at the professional level, that you have that kind of stress on the elbow and the shoulder. I would like to see Dr. Pannozzo take in somebody with that kind of ailment, see what happens.
But the reason they don't let them come back to play early is because you're pulling on the scar tissue created by the surgery.
That's right.
That's why. So now you have a pain, and now they say, oh, the surgery is terrible. Well, we don't stress it, so you don't have the pain, and now the surgery is successful. See, you got to think, why is the delay in there? If you're doing so good, then you should be able to do it right away.
That's what you do. It's amazing. I
And
put
what I do
people
is
in,
you treat people right away.
and when they get the shot, you ask them. I think you wait maybe 5-6 minutes, recreate the pain, and they go, "Oh." Now, Doc,
they can't.
Is
But
this going to last? That's the first thing they ask.
The technique is based on the seeing the area with the fluoroscope, and that guides my.
That's a C-arm, right?
That's a CR,
Right.
and that guides my approach. And so it's not willy-nilly. It's just shot. It's not that at all. It's actually a diagnosis and a visualization, and then treating of it. And you can't rip those. There's no way to rip a ligament like that.
And you know what's amazing? It's amazing to actually watch the people. And I couldn't take all the letters because it's only a 1-hour show, but I mean, let me just give you one of these, Doc. This is the one that really fascinates me. This lady writes, "Because of you, I no longer take 16 pills a day. I'm not allowed to give out a name, but this is a person that says thank you. Okay, 16 pills a day, and you cured her in 2 days.
Yeah. Well, that's what we do every day.
Okay?
We do that.
I mean, just that alone, this way said, thank you for all you do for me. I can't get rid of these. I have to hang them back on the bulletin board. But I mean, there's letters a mile high of people that have gone to doctors and had surgery and now are coming back to him and he's getting rid of their pain. They had double knee surgeries. And now, and this is not a young guy. This guy is probably a little, is he a little older than us or the same age?
I don't know.
He's in his mid-70s, and here's a guy that the three things he loved doing more than anything: he's got a home in Breckenridge to go skiing. He loves golf, and he could not do that until I introduced him to him.
Well, the funny thing is,
That's
people,
the thing.
people should come see you for a second opinion before the
Yeah,
surgery.
no, come in for a first opinion before they see him.
The teams don't have the services that we do available.
Well, they don't have this
They
machine.
have a surgeon who doesn't do this kind of work. They do surgery. They don't do the musculoskeletal work. The trainers don't do it, of course not. They're just technicians. So who do you have there?
Physical
bring
therapists don't know about where the pain really is. They're just trying to.
They could bring somebody in for a consultation, but they'll bring somebody in who recommends a surgery.
And the chiropractors can't do
But
anything.
No, they don't not trained for it. We would never recommend surgery at
No.
all,
Or pills.
or meds, right?
Right.
Or whirlpool, or heat, or anything like that.
The only thing a whirlpool does for me is it just relaxes me and makes me sleep. The hot water and the bubbles. That's all. I think that's all.
But you
it
don't
does.
have these kind of injuries.
Well, if I did, I had one. I saw you.
Yeah, but you don't also play at that professional level.
No, that's
Wait,
true.
they
Also,
need-
They
more
need, and
mobility.
these are big guys too. I mean, you're not talking about our size. You're
No.
talking about
3 times ours.
double or triple. Yeah, about triple us.
And
So,
you got to get those bodies moving, and you need more mobility. I mean, they need twice the mobility that you and I would use.
there's a guy that comes to my gym. He played on 2 professional teams. He's 6'5", weighs 300 pounds of solid muscle. There's not when he walks in the gym, everyone goes, "Oh my God!" Okay? No, I cancel his contract. You're gonna laugh when I tell you, turf toe. I have no idea what that is. I really
It's a
don't.
ligament in the turf toe.
What
Doc.
is it?
You take care of that in 2 seconds.
Absolutely.
But
that's
what
a-
is it?
That's a minor deal.
I never heard of turf toe until he told me. I asked the doctor.
Well, it doesn't mean anything. It's
No.
a stub toe. I mean,
all.
it's a painful joint.
And no team would sign him.
You know why?
No.
Because the way they treat turf toe now in the NFL, the guy could be out for 6 games, 6 weeks.
They operate on that?
No, they give anti-inflammatories, and you put your foot in a boot, and you have to wait until the swelling goes down.
Yeah, but the anti-inflammatories they give you, it's not going to the source of the pain.
It's the wrong way to treat
Right,
injuries.
exactly.
You don't do that. That's not the right way to go.
You know, that should be your next commercial, Doc Turf Toe. I mean, it's the most ridiculous injury. I had it.
You
As
had
a
it?
catcher, I missed a year.
But I mean, is it a very prevalent injury?
It
'Cause,
hurts.
I mean, I heard of
The
all
big
these other
toe,
things.
the big toe
toe.
is very, very painful.
Yeah.
And it's just a joint capsule.
That's the only thing.
It's what holds the bones together. I mean, you got several bones in the big toe. It's 3, and they're all held together by ligament. And when you injure that, ligament is extremely painful, and there's no room in there.
Mm-hmm.
So it swells up, and now it's really painful anytime
I
you
can
walk.
imagine, yeah.
So,
Because you always put the
but we-
pressure on the toe, right?
but
when
we
you walk.
handle
feet,
that. We handle that in 1-2 days. There's no problem with it.
And it's funny, Doc, because it's usually the linemen in the NFL that get turf toe. And
Really?
when you're 300, 400
Oh, of course,
pounds,
you're putting the foot. Oh, of course,
putting
when
all
you
that
stand.
pressure
Oh,
on your
right,
feet.
right.
When you take that snap and you shoot out of your stance, you're using your feet. And that's how you get turf toe. You hyperextend it or whatever.
I asked him what it feels. He said, Les, it's hard to express what happens when a 300-pound line guy is hit by another guy at 300 pounds going full speed. It's like 2 cars. It is a violent sport, football.
I want you to run across this room and run into that pillar, and that's what it feels like.
Man, I mean, that is I mean, seriously, that is
You
a
get
tough-
your
But you,
get
but
your-
you have to ignore that kind of thing and
They're used to it.
relate it to structure.
That's right.
So you got to put a science to this stuff. Yeah, you could talk like that, and then it's it gives you an idea of how severe these injuries are, but you still have to bring it down to structure.
And science.
That's the basic science.
Well, it's really funny because if you're, I know players that don't play or they play through the pain, which means that they probably get juiced up.
North Dallas, remember North Dallas 30?
No, Dallas 40.
40, remember that one?
Yeah, and they get juiced up. And that was, do you know what that was? That was a hammy.
Really?
and he tore it and during the game. And the funny thing is, until I met Dr. Pannozzo, I thought that if you injected the hamstring, that the pain would subside. It doesn't. Ricky Henderson will tell you, the all-time stolen base leader will tell you, nope, it hurts
Yeah, because it was referred from another area.
from
That's
his
why.
hip.
It wasn't.
See, that's the thing that people don't
They
understand.
don't get that. Nobody understands.
No, I mean,
that.
when I tell this to somebody,
Well, they think that the surgeon
Yeah.
is the God Almighty of knows everything. He does not. He knows surgical technique. The diagnosis and management of these problems is not in their purview. It's not what they're trained at.
and every time
They don't-
someone's come in, I've seen what he's done. He
You
said,
think-
no, it's not that.
You think they go to the clinic and treat patients? They don't.
They don't.
They go to the clinics and get them into surgery. That's their training. I was there with them. I was trained there too. And so they just really don't do this kind of work. And I think the surgeon should kind of, well, they're not going to give up their exalted position. That's for sure. So it's going to be, it's very hard. The people that are getting operated should revolt a little bit, get another opinion before you get operated. We're out here. We can do this kind of work.
Well, Christopher Columbus proved to Queen Isabella that the world was. Now think about it. Was he the
And Les was there.
Wait, was that? He had to be the greatest salesman in the world, Christopher Columbus. He convinced them to give me all this money to show the world was round. Well, it's an attitude. People, no matter what we say, we make it 3 or 4 or 5 new patients.
I think he was sleeping with her.
Think so?
Yeah.
With the Queen?
Yeah, that's how he got the money.
how he
Here,
got the money.
outcomes after ACL surgery. ACL surgery. We just talked about this. Now they're talking about selecting the right person for the ACL surgery and also selecting the right ligament, because they take the ligament out, take a ligament from somewhere else, put it in the ACL, put a hole in the bone, and when I think about it, I'd say, well, what
But then
the-
that scar tissue that's going to develop.
scar tissue is everywhere. Now you have to overcome the scar tissue because it hurts. Stretching of the scar tissue hurts.
I would imagine
And so that's what rehab, so-called rehab, send them to the rehab. It's not going to help.
I got a
I
question.
think rehab's more dangerous. If you ask
I got a
me.
question. They're getting that new ligament from 3 different parts of the body.
This-
One of them, it could be a dead body. Doesn't ligaments being taken from different sources, don't they have like different outcomes? Or is
Well,
it every ligament the
This is
same?
what they're trying to say, but
Yeah.
the whole thing is baloney. I mean, it's just,
Can
you want to
you
know the
imagine?
truth. When I'm talking, I'm telling you. You don't have to believe me at all, but think about it. Think about it.
I mean, I get a something from my wrist. Is that going to be the same thing that's in my elbow?
Oh, no.
Or from my hip? Or from a cadaver?
That's not it. It's a scar tissue that comes after it that counts.
But I'm worried about what's going in
Not only
before
that,
that.
but under the patella scars down.
Yeah.
It's called a chondromalacia. There's even a term for that. That's what your friend Jim had.
Yeah.
There's scar tissue under the patella
On 2 knees. So
on
bad.
both knees. That's right.
And that's very painful,
So,
yeah?
Oh, God,
so
yes.
there's a way of treating this, but you don't get it done in the first place.
That's right. That's my
See me
point.
first, then do it. if
Well,
you
just
wanna
what
do
you know
it.
about Tommy John, there's a lot more failures than there are successes.
Look at all these young guys that are having their futures ruined by that. I mean, it is.
But they're trying to change that philosophy, Doc.
What-
That's exactly what's happening. That's why you see it in the newspaper. They're saying there is success.
There
after
is
Tommy
not.
John.
No, you can't point to one success at 34%. That doesn't even. See, in medicine, you need at least an 85% cure rate in order to be proper. 34 is not going to do it.
24.
24, you
But-
shouldn't even do that.
But the
procedure
bottom
at all.
line here is that now they think they've discovered the fountain of youth.
What is that?
These Met pitchers last year, they made it all the way to the World Series, and they're going to copycat the prescription to success. That's why they're coming out heavy. Believe in it, we found the perfect cure. That's what's happening right now, Doc.
Well, it's wrong, and it's going to show up later.
And
Oh,
people,
yeah.
But people are buying into that. And here you have a person
Mm-hmm.
who's giving you a less expensive way of doing it.
Oh my God, 100% cheaper.
And the success rate is better than what they're doing, and nobody wants to come out and try.
I said to everyone, I say it on the radio every week, I said, if you went to Dr. Pannozzo and you have not been 100% better than when you walked in, call us. Tell us what he did wrong, maybe, and we'll listen.
That's
if
not
you're an
gonna
orthopedic surgeon or a chiropractor want to come in, we value your opinion. It's It's 800-889-0267. Be more than happy. For me, anyone that treats chiropractors means that they don't go to a fellow chiropractor for what they need.
Do you have communication with us?
What does that mean, communication? You
Notes.
mean questions?
Yes, questions.
Okay, use the right word.
That's
Yeah.
the right word.
You confused me, Doc. Well, I want to read another letter first. Okay.
Read another letter.
Dear Dr. Anthony, thank you for letting me walk again without pain. I can't begin to tell you what you have done for me, mentally and physically. You will always be in my prayers. I want again to thank you, thank you, thank you. Not bad, right?
Very
How about
nice.
this? With all my heart, I thank you with great admiration. I can't give her name. You have done for me what no one has ever been able to do. Okay. I now go on to some questions, Doc. Okay. Questions for Dr. Pannozzo. Albert from New York City writes, I have bad lower back pain, had it for years. Doctors have said that I have many things wrong with my back, but they have no answer for a cure. I've taken pills, massages, and still no relief. My pain is in the lower back, and I can't tie my shoelaces. The pain makes it hard for me to breathe sometimes. I was a football player in my early days. I would like to know what can I do to get rid of this and to help my life.
This is a lower back pain you're talking about?
My pain, lower back.
Yes, all of these questions are based on what we sent out for lower back pain today,
Okay.
Doc.
Well, there's a way of looking at lower back pain. It's a weight-bearing issue. It's how you're using your ligament structure, and that's where the pain is, it's in the ligament structure. Once you isolate it down, then you have to figure out why that particular one is painful. It may be a secondary, not the primary. So we see this all the time, and we have what we call a scenario. In other words, at the end of your examination, we go over the problem with you, and I call that the scenario. Where is your back pain? Why is it there? And what's affecting it? And how can you improve it? So, and we tell you all that after your exam and your films and so forth. And then we'll offer you treatment for it. So all of this is, we have 100% cure rate on lower back. I mean,
100%. Okay.
no problem, yeah. 100%.
Oh, while we're doing this, we got Mike from Port St. Lucie. Hold on, please. Hey, Mike, how you doing?
Hey, I'm doing well. Thanks for taking my call.
My pleasure. Got a question for the good doctor?
I do. I fell off my bicycle about a year and a half ago, and I broke my radial head, and I tore my TFCC all the way through. The radial head healed okay, but the TFCC has been the worst part of the injury by far, and I was wondering if you had any advice on how to deal with the pain. I mean, I shift my wrist back and forth on a daily basis, and
Well, what is it?
I live with a lot of pain doing lifting for my job with this injury.
What is a TFC? What is that? TFCC? What is that?
It's in the wrist. It's on the pinky side of the wrist. It's like a triangular cartilage complex that holds your wrist together.
Oh yeah, well that's all treatable. That's just scar tissue. That's all it is. It's all treatable. Remember, you have 8 bones in the wrist. They're all connected by ligaments to each other and to other bones. And any of those ligaments could be bothering you. We just isolate it down, find out where it is, put a shot in, it's gone. Just like that.
What?
If you're suffering with that, you're not doing yourself a favor. Come, drive on down and see me, and we'll fix it up.
Well, let me
for you.
give you the phone number so you can call you and make an
Yeah,
appointment.
sure.
It's 561
Okay.
381 5800, and Doc will be off the air at we'll be a little later today, so give him a call and
See,
he'll set something up for you.
This is illustration of the fact that why we're on the air. We do
help
this kind of
people.
work, and no one else does.
Right.
Why is this man suffering with this?
He shouldn't
I
suffer.
was recommended surgery, but I
No.
opted.
No,
stay
surgery
away
is not
from it.
what you want because that causes more scar tissue. So you don't want
Yeah,
that.
well, exactly right. I said there's nothing natural about that. At least my pain is the natural evolution of the injury.
Well, it's not because it's just scar tissue. So we can remove that scar tissue for you. We don't do it surgically. We do it by steroid. And it's
Awesome.
very accurate and 100% effective, and we'll give you your life back. Just come on down.
You will be able to maybe 10 minutes. For, the pain will be going away.
Yeah, you know, Les, when we talk about the results we get, it's hard to understand
I
that
know.
because no one does this kind of work.
It is hard. That's
I mean,
why we do the show.
I created almost single-handedly this whole profession that we do. So, yeah, just come on down. Next question.
Okay.
Thank you. Good to
Thank
know.
you, Mike.
Thanks, Mike.
Thank you.
Appreciate it. Okay. Let me hang up on him. Okay. Richard from New York City writes, I have a bulging disc. God, how many times have we heard that one, Doc? According to the doctors, and they say surgery and 4 months of rehab. I have to take a leave of absence and was told that after all of this, it might not cure my condition. What kind of cure does not guarantee it? What kind of a cure does not guarantee it can help me, and what would be involved?
Well, if you come down to see us, it's a one-day thing.
One day, so come down from New York. I know the weather up there isn't that great. We'll get you a place to stay, tell you restaurants to go to.
You don't have to stay. You can fly in the morning and fly out at night. I mean,
Okay.
if you want to stay, and it's a great place to have a vacation, let me
The
tell you.
interesting thing about that question is that they're offering him to do surgeries with no guarantees.
Of course not.
Yeah, and 4 months of rehab.
Rehab.
I mean, what are they rehabbing? Are they crazy? I mean, you shouldn't talk
When that
like
scar
that.
tissue sets in there, and he does the rehab, he's going to be in agony.
Well, he's going to be worse and worse because unless you understand the mechanism of pain production, you have to understand where the pain's from and why it's from there.
Right.
Because it could be a secondary pain, not the primary. The primary might be something you did before that set you up for it. What if your back is crooked and you're stretching out on the right side down the leg?
Right.
Well,
what
you
people
can't
don't know.
you can't treat that unless you straighten up the
That's right.
curvature.
That's right.
Next question.
Yes, sir. Well, I got someone calling up right now, Doc. I
ahead.
just want to see it's Mark. Hold on. Mark from Fort Lauderdale. Okay. Hey, Mark, how you doing? Hey, Mark, how you doing?
I'm well. How are you?
Good. You're on with Dr. Pannozzo?
Hi.
Hi, Dr. Pannozzo. How are you today?
Good.
I had a knee replacement about a year and a half ago, approximately. I don't have I have less than a 90-degree range in motion,
Wow.
and I have a lot of scar tissue built up. And of course, my insurance company doesn't want to pay for any more rehab. Can you help me with this, or is there something that you can recommend?
Rehab, meaning the therapist is not going to help you. This is scar tissue, and we know how to handle the scar tissue, and they do pay us. So, what insurance do you have?
I have Blue Cross Blue Shield.
Yeah, that's the best one. Everybody should have that one. Don't bother with that. No, don't bother with any of those other ones.
No, United Blue Cross are the two best. That's correct.
Well, I'm worried about United now, but Blue Cross Blue Shield is pretty much
Well,
they take care of everything.
If you
for
want to
you.
call it, I mean, just let them. You can just let them look at it if you're not comfortable. But
Yeah,
I
you have the same
guarantee-
problem of Jim that we talked about, of
Yes.
Les's friend.
Yes.
It's scar tissue after the surgery.
On both
Right.
knees. Both
Yeah, I
knees.
had bilateral knee surgery at one point, but the other one's doing pretty good actually.
Yeah, well, you got lucky on that one.
Yeah, well, that's, but let me give you his number in case you didn't hear it before. It's 561-381-5800. Don't be surprised when that same voice comes on and in his brain. He's the only guy that has a Rolodex built into his head. He can tell you exactly what appointment is here and when it's there. So, Mark, I hope we help you a little, my friend.
When's the best time to call? Monday, I guess.
Yeah, tomorrow.
381-5800. All right, thank you very much.
You're
Appreciate
welcome,
it.
sir.
And I hope, I know you'll be really
Nice.
happy.
Yeah, that's not a difficult one.
Thank you so much, my friend. Have a good
All
Sunday.
right, thank you. You too.
Doc, that's an easy one.
Oh,
The
that's
coach is talking about that's an easy one.
Yeah,
Well,
we know
it
that.
is. It is an easy one, right, Les? Because it's a surgery. We know he's gonna know where to find it. And
Those calls
care
are
of it.
really interesting. Call up, people. I mean, hey, we enjoy it.
Well, what?
You have another question?
Yeah, sorry, Doc. I just wanted to answer your question, but that's okay. I guess we all know who's running this show. It definitely ain't me. Susan from New York City writes, I have lower back pain ever since I gave birth to my twin girls. Doctors have told me this condition is normal and will take time to heal. Something about giving birth and stretching something in my lower back. I'm tired of living in pain and hearing the same thing.
You don't stretch anything out in childbirth. You stretch other things, but not your lower back.
Hey, we ought to put him on the Two Boys from Brooklyn. He's getting good here, Doc.
No, the
lots
lower
of
back.
stretching, Doc. Lots of stretching.
Yeah, there's lower back pain is what everybody else has. So no matter how you get it.
I think so many people complain of low back pain. I mean, everyone's, my back has killed me. I've been lucky because I did what you, before I met you, I did what you always tell weightlifters: do not wear a belt.
Right.
Because, and you know what? I've been telling people at my gym, you walk in my gym, no one's wearing a belt now. Because you're not giving them,
It doesn't make sense.
No,
to wear a
I-
belt.
you shouldn't be lifting that kind of weight, too.
What is it trying to do? Because your pain that you get in the back is like 3 or 4 inches under the skin.
Oh, and also, anyone who's out there listening and they're bodybuilders, I'm going to tell you what to do. 8 sets of a weight that you have a little struggle with, not 10, 12, and 15. That's when you get hurt. Am I correct?
That's right.
Thank you.
Eight reps. That's it.
Now we got a call from Jackie from Atlanta. Thank you, all you lovely people in New York and Atlanta, for responding. Jackie writes, my son heard your show a couple of weeks ago and asked me why hasn't the doctors that he goes to see how to cure a lower back. Well, we know that answer, but you're going to say that. Joey was injured in a car accident, has a hard time walking with pain in his lower back. Doctors have offered to operate his lower back, but haven't explained how this would help him. They say he's having back spasms and hot compress would be helpful to heal. It's been almost 10 months. Can Dr. Pannozzo help me?
Yeah, he must be going to chiropractors.
Yeah, I would say
and orthopedic surgeons. You have to know where your pain is from before you can operate. If they haven't told you that, then walk away from those guys. Go somewhere else or come and see me.
Hey, I got a question.
I'm soliciting your business, actually, and I'm responsible for
I
it.
got a question for you. What do you operate on the lower back?
What do you operate? It's only ligaments.
I know, but what do you
I don't know what they're operating.
Do they go in there and take
They
the
go
ligaments
operate
out?
and they take the ligament out, and you're supposed to improve. You can't improve that way. There is no reason to have a surgery. None. If you understand the anatomy and you understand what causes the pain, it's only ligaments. So one ligament's stressed too much, the other one's crimped or scarred down. You have to balance that thing out, and don't take anything out.
Well, let me tell you to go to a couple of websites about Dr. Pannozzo, which might help you make a decision. It's Pannozzo, PANNOZZO.TV, or you can see him on amp2.tv, Dr. Pannozzo, or just come into his office at 16244 Military Trail and listen to some of the people that are sitting there. Now, I think that's the best way if you're uncomfortable.
The best way is make an appointment so we have time just for you.
Exactly.
And remember, when you come in there is nobody else but me.
Mm-hmm.
There is no technicians. I do the x-rays we take. I do all the treatments. There is nobody else there.
And you know what?
Strictly doctor treatment. That's why we can tell you that it's a one-day treatment for a lower back per place. So if you have several places there, it'll take us a couple of days. But usually the pain that you walk in with, we could take that pain out permanently that day.
Because a lot of things that doctors do not ask, and I know this,
But see, there's no treatments. It's all doctor treatment. I do it myself.
is if you don't know where it's like this. If you don't know where the cause of pain is, how could you fix it?
You can't. That's
right?
the problem, right? You can't use an MRI.
No, because an MRI is just
See, the
bone.
MRIs don't tell you where.
Explain this to a lot of people. What does an MRI actually show on the thing?
It shows whatever the radiologist sees in your film, but it doesn't tell you where the pain's from and why. Okay? Now, we can take an MRI. I can go over it for you. It's going to be practically useless because it doesn't tell you where the pain is. We have other ways of knowing that. So we do special films. We do a standing up picture, which is based on the weight-bearing aspect, which is what we're talking about. Inability to bear weight on a ligament makes it painful. So bring it down to science, bring it down to other things that people can understand instead of mishmashing this. You got, what are all the terms that they use? I mean, they don't mean anything, really.
I think when a lay person comes in, Doc, and they go into a surgeon and they use a lot of things. I mean, you're a plain. What I like about him, Freddie, which I'm saying, he's just a plain, simple guy. Explains it to you in the language that you understand, not all these technical terms, which scares people, and they frighten them to go in for surgery.
I'll give you a good example. We have an MRI, and it doesn't say where the pain's from. Okay, so I do my special film, and they have a scoliosis. The MRI never mentioned it. You see, so that's why you get it because it's prescribed for you, but it's not going to tell you where the pain's from. If you have something strange in there, like a cancer or something, they'll pick it up.
Yeah. So in other words, so when the MRI shows the curvature of the spine, the bone,
It doesn't.
It's not, oh, it doesn't.
Doesn't because they're laying down.
Oh, you're right, MRIs are. You're right. They were laying down.
Yeah, I'm always right.
Yeah, you told Freddie to get his thing fixed, and he told you what he should do.
Well, it's funny. The gentleman that called with the knee injury,
That was Mark. No,
Mark.
yeah, Mark.
and he tells you that they don't want to pay for the rehabbing anymore.
Because insurance only carries a certain amount.
Insurance says enough is enough. We're not paying for that. But the bottom line is the guy's still in pain.
And they're not going to do anything about it. The surgeon does not have the techniques to take that pain out. I can tell you right now, they don't.
And they never told him that it may take longer for the pain to go away.
No,
They're
they're not
putting
going
in
to tell you
rehab.
that. No, they're not. They're going to oversell it. In other words, well, you'll be walking the next day and all that, but that is not true.
And now he's left high and dry.
Yeah.
That's really what's going on.
I go one better for you. I have a relative that before he met Dr. Pannozzo went in for surgery on his hip. Still has problems. The scar tissue is pushing the hip and it's causing him a lot of problems. He can't walk. He went back to the surgeon. You know what the surgeon said? Let me get you a different doctor who might be able to help you out.
To another doctor.
It was another surgeon, though. See, that's
of course.
That's not the thing you want to do. You want to go to someone who treats that without surgery. And now you need special skills for that. You know what? You ought to take advantage of me and what I'm saying as long as I'm working, because we have such good results. You can't believe how good they are. They're really, really top notch.
Well, I always look at it this way. If you have to go in for surgery on anything, I don't care what it is, arm or finger, you're going to have, they're going to recommend rehab because they're going to try you straight, okay? If you go to, again, folks, I'm not knocking anybody, okay? I just know because I've seen it, okay? I'm not an idiot. I've seen things that happen to people that go into this guy. This man, I think he's the greatest thing that God ever put on the face of the earth.
Another question.
You like to say another question, Doctor? I'm telling you how great you are.
Oh, don't worry.
You knew this, didn't you? Okay. Let's get a short one so the doc could bug me. Victoria from Boynton Beach writes, lower back pain has been in my life since I was a young girl. It seems when I was young I had a serious accident, and even though my body has healed, the lower back continues to be in pain. It makes walking very, very difficult. At night I have to sleep on a heating pad. I was sent to chiropractors. They do not offer any help in curing my condition. Can you explain why no one seems to know what's wrong with me? I'm 43 years old and I need help.
Well, why don't you come in and see me and I'll explain it to you.
She's right around the corner,
Yeah,
Doc.
you're right around the corner.
She's in Boynton Beach. Oh, come on, honey. You got to. You don't.
No,
need to suffer.
there are some diagnoses that the chiropractors have no treatment for. They're not God, They have their limitations, and now if there are certain diagnoses which they're not going to be able to handle that, we handle those things.
Mm-hmm.
We'll give you a good description of what you have and tell you how we can get rid of it, and we will.
Okay.
But you got to come in though.
561-381-5800. Doc Janice from Atlanta writes, a lot of lower back today. Can my lower back pain create different pain-like headaches? Let's answer that one first.
I just told you we sent out questionnaire on the lower back.
Oh, I'm sorry. Okay. Well, let's do this first part of it. Janice from Atlanta writes, can my lower back pain create pain-like headaches?
No, headaches are from the neck.
Okay. When my lower back pain flares up, it brings headaches and teary eyes, and sometimes I can't drive or go to work. My doctors say, quote, I have muscle damage in my lower back. That's why I need bed rest and anti-inflammatory. I guess we got the answer now, right, Freddie?
Gee whiz, what are they talking about?
You
You know what you have? You have allergies. That's what it is.
Okay. Got another call coming in?
4 minutes.
Oh, 4 minutes, okay.
The hour's up already?
No, so what do you want? You give all this freaking information. Okay, I got to get another one here. Richard from Atlanta writes, I had lower back pain when I was younger. When I was a younger man, I guess I grew out of it. I'm 54, and the back pain is back. I can't remember if I hurt myself playing sports when I was younger. The doctors want me to ice and heat and relax the muscles. I've seen how you show a number of times, thought this was nothing more than a sell gimmick. But now that I see how my condition is really having problems, the lower back pain also affects my legs. Can I get rid of this? Help me.
Of course, you got to come in. Where are you from?
Atlanta.
Atlanta. Oh, well, hey, it's worth a trip down.
70 minutes on a plane. You'll be in Atlanta. I'll have Uber pick you up.
You know, I have driven 80 miles to see a doctor myself.
I go to my gastroenterologist.
Because
80
I don't
miles.
care where you are. If you're the best there is, I'm going to see you.
And he is the best he is.
And I will tell you that we could take that pain out in one day.
Guaranteed.
You know, the funny thing, Doc, I
guarantee it, yeah.
But I can relate to these questions and
Yeah.
the phone calls you got
Sure.
today. People have heard you on the show and they
Right.
talk to you. They actually call up because they want to hear that they can get some kind of relief. I mean, look at the amount of time these people are living in pain. It's kind of difficult to say, wow, this guy says yes, he's going to help me.
Because what's happening is it being led to the water trough and the and
There's
the
no
surgeon-
water.
Right, and the plastic and the orthopedic guys are saying this is what you're doing to making them drink that water.
Listen, they're not going to guarantee any work that
No.
they do.
How can
because
they?
They can't. First of all, they don't know where the pain's from.
You're looking in the wrong place.
Look in the wrong place, and if you get operated, now you have scar tissue, and who knows where that pain's from.
That's
then
what
after
they
that.
can't understand, people. You're getting scar tissue from surgery, which is causing the pain, and now you're on meds the rest of your life.
Yeah, you don't want to do that.
No, of course not. Okay, we see. We got one more. I could get one in. Let's see. Okay.
Got 2 minutes.
Larry from Miami writes, my lower back pain seemed to have gotten better over the years, but now that I'm older, the pain runs down my legs and my knees and feet hurt. It seems the painkillers, they give me help, but I've had to take more than over time. I don't seem to be getting better. I'm taking more and more pain medications. Can you help me? And what
no,
you do
it's
does really work.
scar tissue in the lower back, and there's no way you can handle that with meds. First of all, how does a med get into a ligament?
I was going to ask you that.
I was going to ask you
So
that
was
too.
I. How does that med get into the ligament? Exactly.
It can't, because you don't have a good vascular supply there.
Wow.
That's why it doesn't work. But so we go directly at it. But you have to know where it's from to go directly at it. I mean, we're not experimenting. This is how it works.
This is, I think, let's see if I got this right now, 55 years of doing this?
53 maybe.
And I think it's 80.
But who's counting?
Well, Doc, at this stage of life, we can't count up that high.
Why don't you give out the doctor's number? You
I'm
got a
going to give
minute?
out the doctor's number because we have 1 minute to go. It's 561-381-5800.
Right.
That's 561-381-5800. I'm going to leave you with this one thought. There is two things that are very, very painful. One is a nagging spouse, and the other is pain in your arms, legs, feet, neck, and head. You don't need to live like this.
You can get an appointment because we don't treat people forever. It's 1 or
No.
2 days, and I really mean that.
All right, we got to go.
So there's
Okay.
always room for a new one. So just call
And
up.
you know, depending how
Gotta
bad
keep-
it is, Doc will take care of you. It's
We'll do it.
561-381-5800. And I hope everyone enjoyed the show. And Doc, Freddie,
Yeah,
board
thank you,
operator, and
fellas.
Gio, thank you so much.
Thanks.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineer concepts for the body.